Hello, and welcome to Skills to Pay Your Bills and this special segment called The Wealth Zone University. Our mantra is change your mind about money to change your financial future. And today, our special guest is Dr. Juandawana Shabazz, and we're going to be talking about women-owned businesses and specifically about Dr. Shabazz's business, which is called Renascance Dermatology, Inc. Dr. Shabazz, thank you for joining me. I really do appreciate it.
Thank you.
We've been reading that it's a female economy. And one of the things that makes it a female economy is that women are going into business and becoming really, really in control of a significant segment of the economy. And you're a woman in business, a very successful woman in business. Would you tell us a bit about who Dr. Juandawana Shabazz is and what Renascance Dermatology does?
Sure, I'd be happy to. And thank you for having me here today.
My pleasure.
So Renascance Dermatology opened August 1st, 2013. And truth be told, it was always in my mind to open the business because prior to, I worked in a group practice right out of residency for almost 9 years.
Okay.
And I did that because, of course, I needed the experience on the business side and just kind of seeing the day-to-day activity outside of seeing patients. My husband opened his practice, podiatry practice, in 2010. And so the thought was to have a family-owned business. But of course, one of us had to work on a consistent basis while the other one gained stability. So he was there for 3 years, and then in the interim, I had my second child, so definitely wanted to make sure I was just being able to go to work and come home and do everything in a timely fashion. So when the time came, after about 3 years of him growing, I came on board. And gratefully, my old employer allowed me to work at both places and then kind of phase out. So I think that's a rare thing to occur for a lot of people, but it really helped me a lot.
Very helpful.
In terms of financial stability, as well as just being able to see both sides of practicing medicine and the business side.
So both you and your husbands are physicians.
Yes.
That is so fantastic. And you and your husband both have your own firms.
Yes. We're in the same office, but we're separate entities. And it's so funny because the patients that come in, I think, are often worried about us because we spend too much time together. But truly, since he does,
part.
it is, and it's not really that bad. We drive separately, and the joke is that I get there after him and leave before him.
That's a good joke.
Yes.
Also very
but it's
good
very
hours,
true
right?
too. Yes.
So why dermatology? What made you go into dermatology in the first place?
Well, I had a rare and very exciting experience. When you're in medical school, you see a lot of primary care, OBGYN, a lot of surgery, pediatrics as your core rotations. But I had a mentor that I, since first year of medical school, shadowed her from first year to graduation of medical school. And I like it because I think a lot of people think of it as a field of just popping pimples, but there's a medical side where you can actually diagnose things. You know, you may get something systemic found based upon the skin, so I like that aspect of it. You can do surgery. By and large, you're not doing surgery in a large OR setting, but you could do surgery in the office, whether it's surgery on pre-cancers, skin cancers, and then thereafter you do a lot of skin cancer surveillance. So there's a lot of prevention, which I like. Thus is why I also have my degree in public health, a master's in that. Okay. And then you can see children, you can see adults. And then what's becoming very popular really across the board in medicine is doing cosmetic medicine. So it kind of gives you all of the good things of medicine in all avenues. But I think what happens is, since you don't see a lot of dermatology in medical school, a lot of people don't realize, or when they do, it's kind of too late and you have to kind of go ahead and interview for residency.
Okay. So dermatology to we laymen is basically pimple popping. Well, but I read on your website that the skin can tell you when things are wrong, disease.
Absolutely.
And then also on the other side, the skin keeps you youthful, aging, and it also impacts your personality.
Absolutely.
Tell us about those things, because those are three diametrically opposed things.
Absolutely. So the pimple popping, yes, it's bread and butter type of diagnoses, but even with that aspect, it has a psychological impact for people because of how they look. And that's what's often so interesting, how a lot of people come in for that reason and don't even have a general practitioner, but they'll see the specialist because of how it can affect them mentally, socially, and emotionally. So definitely there's that side of it in dermatology. And then of course the youthful side, prevention as well as correction, wrinkles, discoloration of the skin, improving texture, and of course all those things lend itself to having good self-esteem and good self-confidence. And, a lot of times people, for their job's sake, it's like I can't do my job if they're in a certain industry, if they don't look a certain way, so we have a hand in helping in that as well.
So when you say you have a hand in helping, that's not plastic surgery.
No.
That's just still various aspects of dermatology.
Right, and plastic surgery, still very necessary field, but a lot of things in dermatology tend to be a little less invasive, although a lot of plastic surgeons do a lot of things that we do too. And I think that's another reason why it's good to do both medical and cosmetic, because you might start off with a cosmetic patient and then they come see you for medical reasons and vice versa.
Okay. Now, anti-aging, that's become the new mantra for we baby boomers, especially the better looking baby boomers on that side.
Yes.
And that's one aspect of your practice too, but it's always been an aspect of your practice,
yes,
even though it's just become a marketing concept.
Absolutely.
How do you help in the anti-aging process?
So, again, it ties together. So if somebody comes in talking about skin cancer and gets a full body exam for their moles and such, part of the education, of course, is wearing sunscreen. And a lot of people with darker skin feel like they don't need it because they have the extra pigment to protect. But then you can kind of add in, well, while you still can get skin cancer with skin of color, though more rare, it can, if you use sunscreen and have good sun protection skills, if you will, then it will keep the skin looking more youthful. You won't have as many fine lines, brown spots, and things of that sort. So here again, you can tie it all together.
Okay, so really for anyone,
yes,
the younger they start being concerned about how they treat their skin,
absolutely,
the less aging, yes, they will have, instead of talking specifically to boomers who we spent all our young years in the sun,
that's
and now
right,
we're suffering the effects, and you've got to fix that.
Exactly, and a lot of people will come in saying that, oh, well, sunscreen wasn't a mainstay when I was coming along, and it was all about tanning with iodine and baby oil.
That's right.
Yes.
That's right. And so just going into the practice, now you decided at some point in time, because I guess you had to do an internship and you had to do residency.
Yes.
Was all that in dermatology, or was it just in general medicine? Or how did that work for you?
So after med school, you do 1 year, whether it's internal medicine, you could do pediatrics, or even a transitional year if you're not quite certain what you want to do. For myself, I did a year of internal medicine. And then after that, then you do the dermatology residency, which was 3 years thereafter.
Wow. You're a brilliant woman. I like that.
Thank you.
But I love the name of your company, and I love the logo. So you've got to tell us about the name and the logo.
I would
Please.
love to. So Renascance Dermatology, Renascance, of course, means rebirth. And actually, I came up with the name after deciding upon the logo. So you often draw inspiration on your family, and so it came from my children. So my son was born in December, and lo and behold, the daffodil is the birth flower.
Okay, and his name is Jelani.
Jelani.
Okay.
And daffodil meant rebirth.
Okay.
And then my daughter was born in May, so the emerald green, which is the color of my logo, thankfully for me, meant rebirth. And so I couldn't call myself Rebirth Dermatology, so to spin it a little bit more classy, we became Renascance Dermatology.
That's fantastic. And what's your daughter's name?
My daughter's name is Jazara.
Okay, so hello, Jelani and Jazara.
Absolutely.
His mom,
Yes.
And so your husband, just to dig into the family a little bit more, What's his area of specialty?
So podiatry.
Okay.
And then again, it's just interesting medicine. A lot of people don't realize what certain fields entail. So again, people probably think of podiatry of, you know, foot fungus, toenail fungus, clipping your nails and things of that sort, which there's an element of that, but there's a surgical side. So it kind of runs in line very closely with orthopedics. And so he does a lot of things with them and in conjunction with them in their cases. So he does a lot of surgery. His residency was very surgical based.
Okay.
And so, you know, in talking about business and wanting to go in it and such, I always thought it would be a nice thing to do, but when I was looking at him come along, it kind of made me nervous because he never came home. And so I was thinking, so if I own my own business, is that going to be the fate for myself, that I'll just keep these long hours and then we'll never see, you know, our children? But again, it just goes with the fact that you can have your practice the way that you want it to be, and, you know, as big as you want or as small as you want.
Well, you know, that's a key, that being in business doesn't necessarily have a schedule. You
Correct.
can develop your schedule. There are certain things that I'm sure dictate what your schedule is going to be.
Yes.
But your life is still there.
Absolutely. And again, with dermatology, there are a few emergencies, so my schedule is more predictable. I do work kind of like an 8:30 to 4:30, and for my husband, Zaki is his name, he does surgery, so there's a lot of call and emergencies and such. So that also makes me have to schedule myself so that I can pick up the kids and make sure that they're all set with school and able to do activities and such. So have to have that balance there.
And so what I like about your discussion is that being a business owner doesn't necessarily keep you from being a mom.
Exactly. And you know, sometimes I laugh with my staff thinking, you know, the way once we're finished with the last patient, anything left? Okay, bye. And so I'm thinking, they don't think I'm probably that too entrepreneurial, but you know, again, you can just make it the way that suits your needs.
Well, that's fantastic, because one of the things I'm sure the audience always thinks about is, how does business and my personal life mesh? And you found a way to make it work well for you.
Absolutely.
While you're still growing your family and your kids are growing up well, and they'll probably become doctors also.
Indeed.
The way things are going.
Absolutely. And here's another great example. I work 4 days a week, don't work on Wednesdays, but if I go on a conference and miss Friday or another day, then I have that Wednesday I can actually add people into the schedule if I need to. So that's nice flexibility there.
I love that flexibility. When we come back, we're going to take a break. We're going to talk more about Dr. Shabazz's practice. So don't move, don't change that dial. Hi, everyone. The objective of the Wealth Zone University is to change your mind about money, to change your financial future. Hi, I'm your host, Don Moragne. In the Wealth Zone University segment, my guests and I talk about a wide variety of business, financial, and other worldly topics. We are seeking to both educate and entertain you. We emphasize that the information and discussions are my opinion, perspectives, and ideas, and those of our guests. We in no way intend to deliver or provide financial, tax, or business advice. You should consult your tax, accounting, financial, insurance, and legal advisors regarding the impact, application, or pertinence of any topic or opinion that we share on the Wealth Zone University. Thank you for being a part of our audience, and please continue to communicate with us through email and Twitter, because this is your show. Okay, we're back, and we're going to talk to Dr. Shabazz about some things that are on my mind. I read recently that it's a female economy, and we believe that being in business for yourself is a way to assure that you can achieve economic freedom. And so you being in business for yourself is very, very encouraging, especially when you are able to mix it with making sure that you still have a family. That's very important. But what do you think about other women going into business? Do you think that being in business is something that women should strive to do? I know you're an exception because of what you've been able to do, but maybe there are other women out there who are thinking that maybe it's too hard balancing both of them. Give me some thoughts on what you think about that.
I think that women should strive to own their own business, but here again, people have to know what's good for them. Now, if they have a schedule that they really just need, to be in and out, then maybe at this time it's not for them. And then also too, again, not looking at what other people have and thinking it has to be that way. I think that's where a lot of the downfall comes into play. For example, I have a colleague that has 3 practices, and in my eyes, that sounds very daunting to me.
Sure.
But it's working for her. I think she started her business before she had her children, so in that regard, that's probably why it works for her. I have another friend that's not married, doesn't have any children, and she has 1 practice, but a pretty large operation. So I think sometimes what scares people away is they'll see other people and think that you have to do it the same way another person did it in order to be successful. So with that in mind, I think you can strive to go into business, but as the old saying says, stay in your own lane and do what's best for you.
Okay, I like that.
Yes.
I like that. And so when you decided to go into business, it was after you made some personal life decisions and some business life decisions, but you were able to transition because your former employer allowed you to work part-time, and how did that work out?
So when
what was that arrangement and how did it work out?
Right, so when my husband opened, it was obvious and seemed pretty practical, I think from her standpoint too, that I would go into business with him. So, I think that was kind of helpful for her in knowing that it wouldn't be a surprise when I was leaving.
Okay.
It's just a matter of when, but we knew that it was going to happen. So maybe that was one kind of platform that allowed that to occur. And so what I did is I worked 2 days in my office and then 2 days in hers. And then after about 6 months, then just phased out and was solely in my own practice. And so I wouldn't say if I didn't have that, I wouldn't do it, but it really did help out, on the financial side and everything else. So even if you don't have that, I still think you can make the leap of faith. But again, knowing, just like anybody, you're not going to go in to the numbers that you were in the group you were in before, but it just takes time to grow.
So who is your ideal target client? Who do you help? Who needs to know about dermatology? Who needs to come and see you?
Again, what's so nice about it, we treat children, adults. Some of my clients come specifically to me for skin of color issues. Now, what happens, I think these days in residency, there's a little bit more diversity taught. However, a lot of the textbooks, when you look at them, the people of color don't have the textbook look. And I actually went to a residency in Los Angeles that, catered a lot to skin of color. So I think because of that, I attract more of those type of patients. But even still, still have a diverse population because, again, with skin cancer, and a lot of people having sun exposure, not just now, but what you did earlier on can later manifest as some problems.
Okay.
So it's just really how you get a regular physical exam from your primary care doctor, important to get your skin checked annually for any changes as well.
Okay.
I don't know if my shorter stature, lends itself to being a little softer, but I do see a lot of children and can relate really nicely to them. So I think
obviously you have 2 children.
That too, not necessarily. I could be kind of frazzled, but I think so. I don't really market specifically to a certain group. Really all are welcome, and I'm happy to see them.
But do you work with a lot of children? Do you work with a lot of seniors? A lot of people in the middle?
If I have to say, my average age group may be about 30 to 40 years old, but again, it runs the whole gamut.
Well, that's very interesting because understanding dermatology, and it's a really big word.
Yes.
But for most people, they don't understand it.
They don't.
So when you have people that are coming to you for a variety of things, that's very, very important and very, 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 very let's see, something that your business can be very proud of.
Yes.
But you mentioned earlier that the skin can kind of tell you when it's ill or when the disease?
Absolutely.
Tell me a bit about that.
So here's one great example. You know, sometimes somebody might be itching to a degree outside of what you see on the skin. There may be nothing there at all. And so sometimes if you have thyroid conditions or liver and kidney conditions, it may manifest as the itching. And here again, remember I was telling you how some people don't even go to a primary care doctor. They may be seeing you as their only doctor, and you don't see anything on the skin, and after soliciting a history, you know, then you check some blood work, and lo and behold, here's some elevated values, and then once that's corrected, the itching goes away. So that's one good example of how you can find systemic manifestations through the skin.
Okay, but in using that as an example, when the itching goes away, that doesn't necessarily mean that the malady has gone away, does it?
Well, usually if the itching goes away and it's something internal, it's because that entity has been treated.
Been treated, okay,
Yes,
okay.
exactly.
So when you find any kind of illness that's displayed through the skin, the treatment is a holistic treatment.
Right.
And you can do most of that or all of that because of your dermatology and your internal medicine background.
Well, with the internal medicine, not so much, because even though you can kind of identify it, guidelines of how much medication and how long you are on it change so much. So if I sent them for blood work and I get it back and see it, then I'll refer them to a primary care, and then they'll, you know, fix that. Many times what I may have given may have helped for symptomatic relief, but isn't treating the underlying condition. So it's very multifactorial issue, and that's why doctors of all type, everybody should see.
Now we all know about Botox, or we all think we know about Botox, but what does that do, and what other kinds of things are people demanding of you to maintain their youthful look and fight aging?
Yes, so Botox is one of them.
And what is that actually?
It's an injectable medication that you use in the actual muscle. And once you inject it into the muscle, it relaxes it. So when people are very expressive, then they can't move that muscle, and so therefore they're not producing a lot of fine lines and furrowing of the skin.
Okay.
And so it's not a tightener, because sometimes people will get it and everything is softened, but if you still have superficial fine lines, then you need other things to treat, whether they're topical exfoliating type of medications, laser, chemical peels. So many times one thing may help, but a lot of people often find themselves using a whole collection of things.
Oh, okay, okay. But so besides that, what other kinds of anti-aging processes are people coming to you to take advantage of?
Laser is helpful. Laser can be corrective, but again, it can be preventative. So a lot of lasers can help stimulate collagen, and when you do that, that can help minimize or possibly prevent fine lines and wrinkles. There are fillers. I don't know if you've ever heard of things like Restylane, Juvederm, so the smile lines and things of that sort. Or people talk about, you always say I'm frowning, and then if you feel the volume in this area with a filler, then once that volume is restored, then it's almost like it gives you a little bit of a lift.
Okay.
Again, most of the time people think of things like facelift and such, and sometimes that is necessary, because if you use a filler, while you might get to that level, you've used so much, it may not be as practical as an option.
And effective,
But if it's very minimal, or you're trying to prevent to getting a certain level, then that would be an option to fill volume, for example.
But we talked earlier about if a person starts younger being concerned about those things that they should be doing to protect their skin, it can very possibly eliminate some of those maladies that they may be exposed to later on in life.
Yes.
And so what things should we be doing as young people?
Number one, again, the sunscreen use and sun protection. And it's not a thing about just using it on exposed skin every day, but if you're outside for long periods of time, you want to reapply it. A lot of times people will comment, well, I'm not really outside that much, but not realizing that ultraviolet A rays penetrate glass. And as a result, we can often tell who's the driver and who's the passenger from texture and tone of the skin.
Really?
So if I could say one thing that one should do for a preventative realm would be sunscreen. Now, lasers and Botox and such, may be helpful, but it can become quite an expensive type of maintenance. So, you know, you may want to do that every now and again, but you may not find yourself doing that several times throughout the year. There are topical medications, many that we use for acne, that exfoliate and have found to have secondary benefits of rejuvenating the skin. So maybe a topical in that realm would be helpful for prevention too.
Okay, but you said something that really, really has me thinking. We think of sunscreen on the beach, and you're saying that sunscreen is almost every day, multiple instances.
Again, because, you know, and that's what people come in and say, oh, well, I wear it on the beach.
Yeah.
But what happens is you forget about the accumulative effect. So when you're driving in the car, a lot of people will come in and say, oh, my hands are aging. I see the brown spots and such. Well, those UVA rays coming through the glass window over and over for years and years, you know, manifests itself later, and then you start to see that. So if you forget about that aspect, then later on you're going to find yourself needing a lot of correction. So if you use sunscreen and do it as a routine on exposed skin daily, while it may not eliminate or make you not get any at all, but it may be much less.
So what FPF should we be using on a daily basis then?
The SPF, sun protection factor, 30 is the minimum now. Now, some time ago it used to be 15, and truth be told, I think on the horizon 50 might be the new one as they continue to study more, change formulations and add certain things to the sunscreen. But right now 30 is the minimum.
Wow, that is so absolutely amazing. Never would have thought that just driving every single day, going outside, is something that we need to be concerned about.
And again, like everything else, sometimes just not having the long-term outlook. You know, in the beginning when you don't see it, you don't really see it as something being very necessary, but then after some time, then it's a thing of, I wish I would have had.
Wow. Well, thank you so much for coming, and thank you for the education.
Oh,
and
indeed.
hopefully all my wonderful viewers out there have learned two things. One, you have to start taking care of your skin early and regularly.
Absolutely.
And two, you found the best dermatologist in the world to come in and help you.
Appreciate
And
it.
three, come back and see us. We'll be here ready to educate you.